Hello friends, welcome back one more time on my YouTube channel. Today we are going to discuss about the worms in the children. In Hindi we commonly tell it as a कीड़े. आंतड़े में कीड़े है. So this is one very common topic, and many times in my OPD the mothers are asking this question, that should I give the worm medicine to my child? Should I give every 6 monthly to my child? He is eating a lot of sugar, there may be the worms in his stool. Is it true? What is the truth behind it? Second thing, how these worms come inside our body, what they can cause inside our body, how will it affect the growth of the children. All these points we will discuss today in this video. It will give you very useful information because there are a lot of myths associated with the worms in the society. Other than this, I have prepared more videos on the parenting topics like the how to breastfeed, how to do the tummy time, how to start a potty training. All these videos are the basic parenting videos. It will be useful to you, your friends, your parents who are just become new parents. That will give them the good information that how exactly to do the parenting. Because now there are a lot of informations available on the internet. Some of the information are true, some of information are not true, and many times it land up the child in trouble. So it is very important for the parents to have the correct authentic information about the parenting. So that's why I have created this channel, so it will be useful to the whole society. So share those videos with the parents and the friends, that will be useful to them. Watch this video till end, it will be useful to you as well. Thank you very much. Now let's talk about the worms. There are different types of the worms. Some are known as the roundworm, some are known as the hookworm, some are pinworm, threadworm. So many names are there, so we are not going to discuss on those details. I don't want to confuse you. Okay, so the common worms are the threadworm or the pinworm. These worms are the very small worms. They generally, if you will see, they are passing into the stool, then you can see it as a white worm. They move. And some of the worms are the longer worm, that is the roundworms. And what all the worms can cause in the intestine, how they pass into the intestine, and how the children is getting affected. So what happened that these worms are staying in the eggs of these worms, stays into the soil. Okay, so whenever the children goes and playing outside without shoes, so if the child has any breach in the skin or the skin is broken somewhere, like the below the nails, many times the children bite their nails, so there are some injuries. So that worms, the eggs worms will pass through this skin. So initially all the worms has their cycle, like the first they will have the egg, then they have the larva, then they are getting metamorphosized and they will form the adult worm. So these eggs are there in the soil, then they will hatch and form the larva, and this larva goes through the skin inside the body. Now once they are entered into the body, they traverse at various places like from the respiratory tract, and then they will come into your intestine. What they will do in the intestine? They will go into the intestine and they will attach to the intestinal linings. When they will attach to the intestinal linings, they will start sucking the blood from it. If the worms are in the larger quantity, and imagine if they keep on sucking the blood from it, what will happen? The child will become anemic. Baby's hemoglobin will go down. And you know, hemoglobin is a very important factor to carrying the oxygen into the body. So that's why if your hemoglobin is down, the baby's growth is going to get affected. So lot of the worm, if they passes like this, they will attach to the intestinal boundaries, they will keep on sucking the blood, they will drop the hemoglobin of the body, and ultimately the growth of the baby is getting affected. Now how you know that child might have the worms inside his intestine? Common symptoms of the worm infections are the abdominal pain. Very commonly the children is telling recurrently the abdominal pain, and the pain will be like the small lasting pain, like maybe 5 to 10 minutes it will be there, again it will subside and again it will come. Many times the child wake up from the sleep because of this pain. Second thing, like these worms pass into the stool, so if they are in a good quantity, you can see with your naked eye, you can identify that these are the worms. Third thing, anal area itching. Commonly the children do the anal area itching. They will do the itching around the anus, specifically in the night. Why? Because what happened that this larva and these worms has tendency to the pass through the anus in the night. So that's why that area is getting irritated and the children keeps on scratching. Now what will happen, as a child will scratch the anal area, there are worms, there are larvas are there are eggs are there, and again child will eat. So what will happen, that larva which are attached, that eggs which are attached on the nails, child will swallow it. So the more worms will grow inside the intestine, and then he will pass, then he will become anemic. Okay. Now one of the common myth or the belief is there that if you are eating lot of sugar, then you will get the worms. This is not true. Many times parents are telling doctor he is eating lot of good, बहुत ज़्यादा जैगरी खाता है, he is eating lot of sugar, so he must have worm, give us the worm medicine. So that is not the truth. So I have shown you, I have told you that how this worm comes inside the intestine. So it is very clear that it is not related with your sugar intake. Now in some countries there is a tradition to give every 6 monthly worm medicine. So the countries where you have the lot of farms and the children are playing outside, there are basic sanitation facilities are not there. Children are going with the barefooted, they are not wearing the footwears. They are more prone for getting the worm infestation. So worm infestation is basically related with your hygiene. You have to wash your hand clean very nicely before eating the food. The food should be get cooked well. After passing the stool, and even without not passing the stool, your hand hygiene is very important. You have to wash your hand very frequently, at least before food. Okay. So the basic sanitation is very essential to reduce the worm infestation. So routine recommendation of giving every 6 monthly worm medicine is not there, but the countries where the incidence is very high, yes, those countries they are giving the worm medicine every 6 months, but routinely it is not recommended. And the medicine is also very easy, like the treatment is also very easy, just one medicine, anti-worm medicine like the Zental, albendazole, one dose is enough. That is for the common, as a standard universal, you can give the worm medicine, but it depends on the type of the worm which are there inside. If it is a round worm, then the different medicine will be required. If it is a hookworm, then the different medication required. So but as a standard, we can give one dose of the albendazole and can see. So these are the informations about the worm in the body and how to treat those worms and correctly how the worms goes inside the body. So wash the fruits, vegetables nicely so that you can remove the eggs of the worms. Do the proper hand washing. Keep the hand hygiene. Don't go barefooted in the farms areas where the worms are there, and like the basic sanitation facilities should be there to reduce the worm infestation. I hope I have cleared a lot of doubts related to this, and if you still have any questions or queries, you can put in the comment box. I will answer that one. Thank you very much.